So, of course, we're talking about mindfulness strategies for youth. Some important considerations to go when you're working with kids versus adolescents and so forth. Just general strategies and techniques I've used and have found in the literature for you all. Before we go further, got to give thanks where thanks is due. Dr. Monica Johnson provided some of the adolescent and readings for the mindfulness strategies, and I gathered a lot from her presentation on it. And Dr. Jean Cobb for the relaxation exercises for kids as the handout is where that came from. So I thank you. I want to send my thanks to those presenters. All right. So when we think about mindfulness, you have two different ways you can think about it. And that's represented by our little cartoon below. Is you're mindful or are you mindful? The essence of mindfulness is that you are purposefully paying attention to your surroundings, your own interpersonal experience, and the world. You're not just going on autopilot. It's interesting when you think about our human experience, and I'll speak for myself here, is that every morning I get up and I come out the driveway and make a right to come to Cherokee. I make a right to go down to Cedar Bluff or anything out of that. There's one day a week where I have to turn left, and 9 times out of 10 I always turn right because I'm used to turning right. It's just almost like my motor program. I'm not very mindful of my surroundings. I'm not purposely paying attention. I'm just doing what I automatically do. Mindfulness is taking yourself out of that automatic program and saying, I'm going to purposefully pay attention to what's going on and do it as if it's the first time you're doing it. Car accidents happen most often within 2 miles of your home because you're new in a place, you pay attention to it, you look for cues, you look at things, and so you pay more attention to it so you aren't likely as to get in an accident. Have you all seen the movie Click? All right. If you know, like or hate Adam Sandler, it's a great movie. Is that he has this magic remote control and he can fast forward through life or pause life and play life. And as the movie goes, he wants to fast forward through all these boring things like, I just want to get done work. And so he fast forwards through work. And I just want to make partners. So he fast forwards his life partner. But then all of a sudden, the remote control goes on autopilot and he fast forwards through the parts of life he really wants to pay attention to. And that's what can happen with us if we're not mindful of things. Once you go on this autopilot, once you start doing things just out of routine, time passes you by a lot quicker. And so what mindfulness does is it brings us back to the center point and lets us slow down time in our perception of it. And that's one of the things that we often hear about when I'm doing groups. Let's do my DBT DBT group, is that people find time slows down when they stop and basically smell the roses. One of the core experiences of being mindful, you have to be non-judgmental. And that can be difficult for some of us. Basically, we all make mistakes. We all have things that come into our head when we don't want them to. And the purpose of mindfulness is just being able to focus on one thing. So it's important that we're non-judgmental when we find our brain does wander. We need to be able to come back to that thought, back to our experience freely without having a judgment interfering with our ability to come back. Mindfulness and purposely paying attention to other therapies like that are considered the third wave in CBT. I was reading through some of the literature that's listed in our resources, and they're really seeing this come through as the new way to start treating things as far as a part of other types of therapies. Mindfulness has really picked up steam in the past 7 or 8 years or so as far as being in the research and being empirical evidence for it. So it's really starting to transform how we think about therapy. Mindfulness is really useful in conjunction with other therapies. On its own, when I was looking through the literature, I didn't find that it was listed as an EBT just on its own for any particular disorder or therapy. It's usually used in conjunction with other therapies. And that's important because it's only going to be one aspect of what you're overall doing with a client. Several evidence-based treatments like trauma-focused CBT, dialectical behavior therapy, acceptance and commitment therapy, focus very heavy on mindfulness activities. DBT, for example, I'm taking up Dr. Johnson. We're in our collaborative, and every week we have a mindfulness exercise we're supposed to do. And the point is that you have to be practicing mindfulness. It's like working out, is the example I use with my clients. If you go out to the gym, you start getting all buffed up. If you don't go to the gym for a few weeks or for a little bit, it's harder to build your muscle back up. So mindfulness is the same way. You have to be practicing it 15 minutes a day, 10 minutes a day, over a few days here on a routine schedule so that you get used to it and you can almost use it at command. If you want to be good at doing mindfulness and teaching mindfulness, you have to be good at mindfulness. You have to be mindful yourself. Now, I'm not perfect at it, as I just said. I turn right instead of left 9 times out of 10 on my development. But it's something I do practice and take the time to smell. And I'll give a few examples later, but taking the time to smell the roses there. Uses for mindfulness. This is so great for helping kids who are anxious or have anger problems, coming down and relaxing and being able to take their mind off of what's troubling them. It's really a great distraction task at times, so they can come back to their senses. I often, I have a little brain in my office that I show kiddos about what happens when you get angry. And going a bit of biology here, we all have, there's a couple different layers of our brain. You know, we have the midbrain, forebrain, and cerebral cortex there. When we start to get angry, we start to get frustrated, we're not using our whole brain to think. Basically, our frontal lobes start to turn off a little bit, and we get very impulsive. And that's what tends to happen when somebody gets caught up in anxiety, or they get caught up in frustration or anger, is they're not using their full brain. And so what mindfulness does is it lets you relax and come back to use your frontal lobes and use your braking mechanism. Say, hey, no, it's not a good idea to throw a vase at my mom right now. That's a bad idea. And so forth. So that's what I really use mindfulness with my kids that have anger issues. It helps kids with ADHD too. I said it can be helpful. It's not an evidence-based practice for it, but can help them focus on a single task at a time. One of the parts of mindfulness is that you practice focusing on a task. And, other thoughts will come in, and we'll get to that you got to let them go and so forth. But it really can help kids get practice at focusing on one thing at a time. Encourages the parasympathetic response. We've always told people, take a deep breath when you're excited. And again, that's because when you have your sympathetic nervous system, you're like fight or flight. You start getting anxious when you see that feared stimulus. You start breathing shallow, and a bunch of other things happen. If you start taking deep breaths and relax yourself when you're having that fight or flight response, your nervous system will come back. The parasympathetic nervous system kicks in, which that nervous system starts to calm you down and bring you back to your faculties there. So that's another real important reason why we tell kids to take deep breaths a lot of times, or you might tell a friend to take a deep breath when they're excited or upset, to bring them back down. Helps people with emotional regulation issues. As I was looking through the research, they found that people who were engaged in mindfulness activities were better able to regulate and make correct choices or good choices when they were able to think fully and relax and so forth. It helped them choose an emotion or experience an emotion that wasn't debilitating to them. Okay, so there are several types of mindfulness. You can almost have a smorgasbord up here of different mindfulness activities you can use. There's something for everybody. You have eating mindfulness, walking mindfulness, seeing mindfulness, body awareness, also consider that progressive muscle relaxation, breathing, sitting mindfulness, thought awareness, and more. The list goes on. Anything you're doing, you can do mindfully. And there's different techniques to use and different scripts you give yourself when we're going through these. But it's really important that you try all out to work with the kids. If they'll do breathing or body awareness and so forth. So it's important to kind of choose like a menu of what options you choose for a kid or that are interesting to them. All right, so getting into the meat and potatoes. With kids, and you're doing mindfulness, like young kids, I'm talking 5, 6, 7 years old, imagery is key. Children get very bored with a task where all they have to do is sit, or all they're doing is one thing, or all they have to do is something repetitive. They'll get very bored. If you have a kid who has attention issues or hyperactivity issues, they're going to be bouncing off the walls and so forth because we're not keeping them entertained. Kids don't like it when adults are talking because it's boring for them. Kids hate boredom. You can do work observing automatic thoughts with the correct handouts. There's some great handouts in a coping cat protocol for anxiety that I've used with kids that help them figure out automatic thoughts and how their thoughts influence behaviors and their thoughts coming to mind and so forth. So that is possible. I don't focus a lot of work with my kids doing mindfulness on their tracking their thoughts and letting go of thoughts and letting new thoughts come in and so forth. And again, that's on the real younger ones because I've just not had much success with it myself. Perhaps some of you have better techniques to use with them, but I've not found great success when using imagery or other things with really young kids doing mindfulness and tracking their thoughts. The best way I've learned to teach kids deep breathing is pizza breaths. When I was first learning of mindfulness and I didn't have these wonderful techniques to use, I would try to teach the kids deep breath through repetition. So in through your nose, out through your mouth. And I wasn't getting a lot of success. What I found is there's something called pizza breaths. And I'm going to use my friend Robert down here as an example. Robert, what's your favorite pizza?
Meat Lovers.
Meat Lovers Pizza. I love Meat Lovers too. I love it. Where do you get it from?
Pizza.
Pizza Hut. That is a great place for Meat Lovers Pizza. Oh, you get all the bacon and the pepperoni and the ham on there. It is divine. So I want you to pretend something for me, Robert. I want you to pretend you have a big old Pizza Hut Meat Lovers Pizza right in front of you. All right, I'm going to cut this up for you, and I'm going to toss you a slice. All right, so you have your slice in front of you, and I have them do this. They have the nice little slice in front of them. And I say, let's take a whiff of this pizza. Oh, that smells good, doesn't it? Robert, what happens when you eat pizza that's fresh out of the oven?
It's hot.
It's hot. You need to cool it. It burns your mouth when you eat it. So we can't have that. We can't be burning our mouths on our imaginary pizza. So we have to cool off our pizza. So let's take another whiff and cool it off. When I started doing that with the kiddos, I've not had a kid yet that when I said, did you do your pizza breaths? They haven't said yes. They remember pizza breaths. They remember their favorite pizza. That's a great way for kids to do mindfulness exercises. I did this with 3 kids right in a row. One kid had anxiety, one kid had attention issues, and the other kid anxiety too. And they all came back the next session so eager to tell me how they did pizza breaths while they were doing their homework. And they were just so happy that they were able to sit down and do their homework. It was only 5 minutes. And they, of course, were rambunctious, but that helped them out a lot when they were able to remember to do their pizza breaths. So that's something I encourage you all to try with kiddos that are having trouble with remembering how to take deep breaths and relax when they get anxious and so forth, is try those pizza breaths. Progressive muscle relaxation. You can do this with all kids. The same thing with pizza breaths. Young, old, doesn't matter too much. And if you look at your handout here for relaxation exercises, this is a great handout. I almost have this script out when I'm doing it with kids. It gives imagery for things like squeezing lemons. So if you all want to hold out your fists real quick, and we're going to squeeze some lemons. All right, we're going to make lemonade. And I want you to squeeze those lemons and hold it and hold and squeeze and squeeze and squeeze and squeeze and let go. All right, and then you squeeze the lemons again and squeeze and squeeze and squeeze and squeeze and squeeze and let go. All right, we made some good lemonade there today. And you're having the kid, as they're doing this, paying attention to how their muscles feel, how it changes. You're having them sense for tenseness. I know when I was doing this as a graduate student, everybody stores tension in a different place, and I found that I store tension in my thigh muscles. I tend to get, when I get nervous and so forth, that they really tense up, and so I've learned how to relax them. And that's the purpose of things like progressive muscle relaxation, is it's a distraction for the kids. They're focusing on a different sensation. You're also showing them where they should feel tension. Because when I try and do that and I have my thighs already tense, I couldn't tell the difference between I was tensing them and I was letting them go. And so through practice of this, I learned that I have to let that go and how to do that. But the other, besides squeezing the lemons, my other 2 other favorites is if an elephant's coming. All right, so an elephant's coming down, we've got to prepare, we've got to squeeze our stomach muscles so the elephant doesn't step on us. Squeeze, 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 and let go. All right, and it's important to have that enthusiasm. If you're just doing this reading off a script, they're going to lose track of you really quick. So you got to make this young and exciting for them, and if you're enthused about it, they will too. My other favorite one is this, because the kids you got to pretend there's a fly in your nose, and you got to squint your face. You can't use your hands, you got to get the fly off your nose. And so they make all these funny faces trying to get the fly off their nose. And at the same time, they're tensing their face muscles, and then they're relaxing them. And tensing the face muscles and relaxing them so they get an idea of how their face senses up and so forth and what that feels like. Again, I encourage you all to read through this script. It's a wonderful handout from Dr. Cobb here on how to, different imagery techniques to use with kids when you're doing relaxation. Different strategies, and a whole nice script for you. So you don't have to be a master's level therapist to do this. You can just, as long as you've got a reading, you can read, you can do this. It's very easy. It's and encourage the kids to practice this too. Again, with pizza breaths, anything that we're doing today, they have to practice at home. They have to do this outside of therapy, outside of your session with them. Like we want kids to do with all therapy, right? It only works well when they're thinking about therapy or doing it outside of their period with you. All right, so belly breathing. This is another one. I have a little two-seater couch in my office, and so I have the kid lay down so his torso is flat on it. And the Teenage Mutant Ninja Turtles are big right now, so I use a little ninja reference about Master Splinter, and the Teenage Turtles have to learn how to breathe through their bellies so that they're good ninjas, and so there's a whole script I use for that. But the point is, you have the kid place their hands like this onto their belly, all right? And you want them to have their hands raise up and down or their belly raise up and down as they're breathing. All right, and say, that's a deep breath. Feel that, all right? And then you see, watch their belly raise up and down. Then you tell them to put their hands on their chest. And you want the chest to expand this time instead of the belly. And you'll notice, hopefully, that they take shorter breaths when they are breathing through their chest versus through their abdomen. And this is true of adults too. If you notice yourself breathing through your chest, chances are you're leading to a sympathetic response. People who breathe through their chest and have shorter breaths are more anxious. So we want to encourage kids to breathe through their bellies. So I really draw their attention to that. And some of my kids have had difficulty with that. The one anxious kid I have, he had a lot of difficulty being able to breathe out of his abdomen area. And so we worked on that for a session or two, being able to raise the hands up. And at first he was trying to force it, saying, look, I'm breathing out. Pelvic thrust. I was like, no, that doesn't count. No, don't do that in here. So it's to practice that and pay attention to how their abdomen moves. And for adults too, and for you all. Follow the for old because this is I'm staying on a relatively boring task for a period of time. And so older kids, I'm talking 8, 9, 10 years old. 4 and 5-year-olds, I really wouldn't do this with because they're not going to be able to understand all the sensations I believe that are coming through. I haven't had success with it when I put it that way. But some of the older kids, what I do is after I've taught them pizza breaths and after we've gone through belly breathing, it's something I call follow the breath. And that is having them be mindful of their breath. And this is all kind of like basement stuff. This is the foundation for the larger things we're going to be doing, is these breathing exercises. They're not meant to be the end-all and be-all of meditation, but when you're doing meditation, you have to have breathing down. So I start them with the belly breathing, and I have them follow the breath. So when they take a breath in, I give them a narrative. All right, pay attention how your breath hits the back of your mouth. What's the air temperature like going in? How does it fill up your lungs? Notice your clothes. Notice your abdomen moving. Do you feel any pain and so forth? And I have them literally just follow the breath as it comes in. I have them hold it, and then there's just the reverse process. Body, when you're exhaling, what's moving on your body? What do you notice about what's happening with your abdomen as you're exhaling? How does the breath feel when it's leaving your mouth? Where is it touching? Is it breathing out of your nose? Do you feel your nose stuffed, etc.? So I have them follow that breath outwards and really focus on it. And the key here, like with any of these mindfulness that we do, is every time they breathe or every time you do one of the activities, you treat it like it's the first time you're ever doing it. And the reason is so you really pay attention to what's happening. That's key with any of these, is it has to be like the first time. Otherwise, you're into the motor programs, just things automatic. Don't. It's the first time. Mindful eating. This is a great one I like to do with kiddos. If any of you have any snacks with you left over, you can try this too. I have those little Hershey bars, y'all know, not the big old ones, but the fun size, the kid size ones. You give them at Halloween. I have one of those. You do mindful eating. And the kid wants to gulp it down. And I used this just the other day when I was eating some nice prime rib, is that I wanted to, so it's about slowing down. So you have them take a little piece of chocolate, and you have them smell it. You have them feel the texture of it, all right? And then you have them nibble, just a little nibble there. And what do you taste? Where does it hit on your teeth? What's the texture of it? How does it taste when it's going down your throat? Is there an aftertaste after you've swallowed it? Let's take another little bit and take a sniff. And of course, I'm slowing all of this down. But take a sniff. What does it smell like now? And how does it feel when it's in your mouth? Let's take a little bit bigger bite. How does that feel in your mouth? How does it taste? What do you notice about it? Where do you notice it on your tongue? How does it feel when it goes down your throat? And you take them through this. And you spend about 15 minutes eating a small piece of candy. I have never, outside of this, seen a kid spend 15 minutes or so eating a small piece of candy. Parents would think I'm crazy if I didn't do it in front of them, right? Maybe more like 10 minutes or so, but it's a lot longer than they normally would have. And as adults, we can do this too when you're enjoying a nice filet mignon because you just happened to pass your EPPP the other day. You want to take, thank you. You want to take and savor that. Yay. You want to savor that because that's not an everyday thing. So you take your slices of it and you smell it. You make sure you're smelling your food too. You know, when we have colds, we can't taste very well because a lot of our taste comes from our noses and our olfactory sense. So you want to take your time to smell it and chew it slowly. Pay attention to the bites, how it, the juices that come out when you're eating it, the taste of it, the texture of it. And do that for every bite. Because otherwise you're going to just go on an automatic pilot for some really great food. And you'll miss the experience of it. So it's important here to slow it all down. Seeing mindfulness. I do this with older kids, and there's two versions I do of this. And one version to help them practice on seeing the details of all too often miss the details. For example, if I were to ask you all to keep your eyes on me and tell me how many ceiling tiles there are here, nobody would probably be able to tell me. If you're a patient in a hospital room, I can bet you Sweet Bippy, that you know how many ceiling tiles there are in the room. Because all you have to do basically is count the ceiling tiles, right? But we don't notice these things. And some of it is that we were mindful for everything we'd go batty. But it's important for us to pay attention to the small things. So one of the things I do is I have them sit down and I'll have them look at something. One of the ones is these, y'all know those 3D things that there are these images that don't look like it and you have to like unfocus your eyes and all of a sudden these images are supposed to pop out. I could never do them for the life of me. Never in my million years could I, and I still can't do it. I'm amazed at people who can. But I have the kiddos look at this and look at the different color patterns, and pay attention to how the colors meld and where they are harsher next to the other, and really take a look at the overall visual aspect of the presentation and the little minute details too. And then to get them in the habit of it, I have them report back to me. And they still have the thing in front of them. It's not a memory task, mind you, but it's something that helps them learn to pay attention to the small details. The other type of meditation, seeing meditation, is more of relaxing meditation. And this is when you're just taking note of something as the whole. And I think, oops, I thought I had that slide in there. Anyway, I think it's on the slide, but you have, they can pay attention in seeing mindfulness. Either a crowd or you know, something moving, something stationary, and you want them to pay attention to the whole overarching part of it to see, you know, take in its aspect for what it is and how they feel about it, and be mindful of their emotions and their experience of the object. If it's something that's moving, you don't want to have them pay attention. It's kind of like the opposite. You don't want them to pay attention to the small parts. You want them to pay attention to how the form moves and what they notice about it and so forth. Like clouds in the sky and so forth. You want to have them pay attention to just the whole cloud, not necessarily the ripples that might be in it. All right, games. Yes, you can do games in mindfulness. You probably all do games. You didn't realize you were practicing mindfulness anyway. I'm going to jump down to the last one because that's my absolute favorite game to do with the kids. And they all ask for it because Star Wars, luckily, is getting big right now. And you all can get one of these great things too. It's called the Star Wars Force Trainer. And I promise I'm getting no kickbacks from this. It's just a really great toy that all my kids ask for. And it's relatively cheap, $25 or so. And what this does is the kiddo wears this headset. And it uses passive brainwave technology, allegedly. And it measures the kid's beta waves. So when they're concentrating, what will happen, and it takes a while to boot up. I tried it earlier and I wasn't playing nice. But what happens is as the kid concentrates, there's a little ball in here that a fan will blow the ball, and so it's like the kid's using the force to move the ball up and down like Star Wars movies. And so as hard as the kid's concentrating, and when they're concentrating, the ball moves to different levels, and Master Yoda's on there to coach you and say, "Good Padawan, learn you must clear your mind." And the kids just get a kick out of it. And you know, the kids I'm working with ADHD or anxiety issues on, they go, "Can we play the Jedi game?" It's like, if we have a good session. And little do they know, they're really doing additional mindfulness work. Instead of going to the gym to play basketball, we do the Jedi game. So it's a really, really great, and one of my favorite toys. I bought it just because I thought it was cool. I didn't realize I'd have a therapeutic use for it. And it used to be $100. So I was like, $25 is a great deal. And it's good for adult friends too. They get a kick out of it. Anyway, games, you really also want to focus on games that require concentration and focus. Jenga is an excellent example of this. Obviously, if a kid has motor issues, this isn't a good game for them. But outstanding of that, Jenga can be a great game because they got to be very careful and mindful of how it's moving, and you can draw their attention to these aspects of Jenga as they're doing it. So as they're pushing the thing, guiding them, having them take deep breaths, and so forth. This is an excellent platform for them to practice and use mindfulness skills. Operations, the same thing. Again, have to have a pretty steady hand there. But again, concentrating, pulling out little things. I was never particularly good at operation. I was just a little klutzy. But help the kids again use their mindfulness activities. Building a house of playing cards. Perfection. That's the one where you have to put the different geometric shapes into the right puzzle hole, or else the whole thing blows up in your face. I think that's that one. And Simon, electronic memory game. That's another great. I don't have a Simon, but I know I'd be pretty busy with it if I did. So moving on to adolescence here. Children and adolescents require are different cognitively and require different skills. There's just so much that happens as a kid grows older, and it would be a shame, if you were trying to do with a 17-year-old, squint your face to get the fly off, they might look at you kind of funny. Or if you're trying to do pizza breasts. I've gotten a few funny looks when I've tried to do pizza breasts with a 16-year-old. That didn't go over too well with them. But so you need to address things a little bit differently. And again, some kids, they're different developmentally. Don't just look at chronological age here, right? We have to look at the developmental level of the kiddo. And you definitely want to focus on different things. Adolescents have a bit better ability to be mindful of cognitions. This first reference is dated because I don't think, well, perhaps the adolescent girls do, but not the boys. Pooh sticks. Anybody remember Pooh sticks from Winnie the Pooh? The whole premise of it was, thank you, Chad, was that they dropped a stick on one side of the bridge and they watched to see if it floated out on the other. And the sticks would float one by one, and that's what I kind of thought of as far as our cognitions when we're being mindful. So after you taught your teenagers got a solid hand of that kind of meditation, you can then start focusing on having them track their cognitions. And what can often happen to all of us is we have a million thoughts come to us at once. And it can be, especially when you sleep, right? You start to go to sleep, everything that you didn't do for the day or you need to do tomorrow comes back. I've had that happen quite often to me. And so I use mindfulness when I need to focus my mind, when I need to take my deep breaths and get myself. So the goal of sticks and light metaphors, bubbles floating up in a conveyor belt. Have a thought that comes to you. You recognize that you have the thought and you let it go. You don't linger on it. You don't dwell on it. You don't connect it to anything. You experience it as a cognition, as a solid unitary thing. And it comes in front of you, and just like on a conveyor belt, it passes in front of your field of vision, and then you watch it and let it go. And the purpose of that is so that you're not dwelling on things and you're not so angry about them. And this is what's a little bit more difficult, and kids need, and adolescents need a little bit more practice with. And it's useful to use these metaphors and help them understand that, okay, so you're worried about your mom. Let's just take that for you're worried about your mom. Okay, deep breath. Next thought. And the purpose of the non-judgmental is that thought, or that when you're trying to focus on one thing, let's say the aspects of a picture on the wall, and you're trying to focus on the picture, you have other thoughts that come into your mind when you're trying to do something, okay? And so you don't tell them to say, no, go away, don't think about that. You have them recognize that thought has existed, and then you're going to have them say, okay, now I'm going to go back to looking what I'm supposed to be doing. All right, I'm focusing on my homework. Okay, I was thinking about school. I'm going to let that go. I thought about school, now I'm going to focus back on my homework. Versus the opposite of that is purposely trying, no, I can't think about school right now. I've got to work on this. What is this? All right, it's easier to have that thought come in on the conveyor belt and let it go back out. So that they non-judgmentally go back to what they wanted to be doing. This starts to kind of coincide when I have kids start counting breaths. So when they're taking deep breathing, and I want them to really focus on the breath, I have them count breaths. And this is when I'll introduce the idea of the conveyor belt or the poo sticks or the bubbles floating up. Thoughts will come in while you're doing this. You're going to lose count. If you lose count, that's okay. We're just going to start back over at 1, and you're going to be just fine. I'm not trying to see how many breaths you get in a 5-minute period. You're just going to practice on counting them. Okay, and the purpose again is to get the kid to focus on one thing at a time and acknowledge that other thoughts are going to come into your awareness at this time, but you're going to allow them to come in and you're going to let them to leave at the same way that they came in. And that takes practice. That took me a lot more practice to get good at. And I still lapse at times, many times. This was a little bit more difficult of a thing for me than just learning how to breathe or do progressive muscle relaxation. And again, being mindful and non-judgmental of thoughts underlines all relaxation strategies. That judging themselves kind of do the opposite effect of what we want, or if they're judging their performance. They just need to keep trying and keep pushing. That's our goal here. Okay. Strategies for adolescence. Again, this is the progressive muscle relaxation, similar to what you've got in your handout here. The difference with the adolescents is that I go over more muscle groups. If I ask a kid to flex his calf muscle, he's not going to understand too much what I mean. Adolescents start learning more about anatomy and physiology and play sports and so forth. They know what a calf muscle is. And they know how to squinch their toes. And literally, I take them through every muscle group, from pinky to nose, on this progressive muscle relaxation. So I can squish their toes in their shoes and pay attention to that. Practice all this, and they're squishing, and they're letting their body in between cycles of the tense and relax, scanning their body for pain or other sensations. And it was during those body scans where I kind of took my mind's eye and went from head to toe to see how am I feeling, what are my muscles like, my body, or where are my arms in relation to my legs and so forth. Where's my body in space? Paying attention to that I found out that's where I carry my tightness, tenseness is in my thigh muscles. Everybody carries it somewhere when they get tense. So those body scans in between the tense and relax are something that I really utilize with the older kids. And then, of course, paying attention to how it feels when they let go. And again, taking those deep breaths through it all. So that's the big difference between the children and adolescents for progressive muscle relaxation. Counting breaths. As I said, I do that more with the adolescents too, because it starts to have their mind come in and their thoughts come in and so forth. They just count the breaths and see I time them for like 4 minutes, 5 minutes, and I let them get relaxed. And I have to be relaxed too in this, because the kids are going to pick up if I'm anxious about getting my notes done or what time it is and so forth. So it's important that you almost try and project feelings of relaxedness so that you yourself stay relaxed through this. Walking meditation. I've not done this one terribly much with my kiddos at Cherokee, mainly because if I took them out in the halls, it's always a busy place here. Lots of activity going on, it'd be kind of difficult. We do have a gymnasium upstairs, but sometimes that's a gamble if somebody's using it or not. So, but this is great for kids to do on their own. And this is, again, paying specific attention to walking. And if you think about how we walk, most of us hopefully do this automatically without thinking. Otherwise, walking, so people can't walk and chew gum at the same time. But you never realize how complex it is at walking until you actually stop down and look at the different motions. So you're picking one foot up, left foot down, releasing, going back up on the heel of the foot. Simultaneously, you're putting your other foot down, and if you purposely try and slow it down, you're going to fall. But the point when you're doing a walking meditation is to pay attention to how the motion of walking, how you're touching the ground, how much pressure is going onto it, what part of your foot is flexing at this time, pain when you're walking, what part of your knee is moving, almost paying attention as you're walking, really paying a lot of attention to the lower part of your body as you move up and so forth. It's a lot more complicated. There's so much to go off. If you can get a page narrative of narrating somebody walking or telling them to pay attention to certain things as they walk. And of course, not only are you paying attention to what's walking and how their weight shifts and so forth, but you can also then have them focus on what it's like outside, the deep breaths of the air, what are they as they breathe in and so forth. But to really have them sit down and focus on the thing that's going on, rather than just that you're getting from point A to point B. And again, that really slows down time for a lot of people when you start taking those deep breaths and paying attention to how you're walking and your surroundings around you. Paying attention to the little minute details really brings things out. Sitting meditation, I went over that already on the last couple slides there, but just have a patient examine an object without having to have thoughts or judgments about it. So that painting looks ugly, or the cup of water glass is half full, and so they would merely just describe what they see without having a judgment or any kind of value placed on it. All right. So, general guidelines for mindfulness. Mindfulness needs to be practiced at home daily, or at least 5 times. 5 times out of 7 times in a week is great. And again, don't do it when you tell the kids not to do it when they're going to bed, not to do it when they're about ready to go to sleep. Sometimes kids are one way or another about doing it in a classroom. I say you can always do pizza press in a class. No one has to know. You can do seeing meditation in your classroom. Nobody has to know that you're paying attention to the concrete on the walls and how it affects and how it looks and the little divots and so forth. Some kids don't like to do the progressive muscle relaxation, and that's just fine. But again, I liken it to them doing working out or doing sports practice, if you will. Is that you have to practice it at a neutral time. Oftentimes, kids will only use interventions when they're angry, like, oh, I'm supposed to deep breathe. No. If they don't practice this when they're in a neutral time or when they're okay, they're not going to do it well in the game. When I played soccer, my coach would always tell us, what you do in practice is what you do in games. You want to tick them off, you'd say, it's just practice, coach, it's no big deal. They have to practice neutral so they can get good at it. And you as therapists, us as children have to practice this ourselves so we get good at it, so we can guide them, and so we're practicing preaching, so to speak. And it's good for us too. Not to be done in bed at night or when you're tired unless your goal is really to go to sleep. Then it's okay to do it at night because you're going to go to sleep after you do this. There's a pretty solid chance of that. So you don't want to do it at those times unless that's your intention. During all mindful activities, you're always deep breathing. You're always being non-judgmental. You're following your thoughts, especially with kids. That's key when I'm doing mindfulness. And to do it with the kid. Oftentimes I'm doing pizza press, I'm doing it with the kid. When I'm doing muscle relaxation, I'm not just reading the narrative. I'm doing squeeze the lemons, arch the back like that, the whole 9 yards there. So it's really important that you try and do this with the kiddo, and so you have to practice this as yourself if you want to use this, so that you're good at it, and so you can kind of model what appropriate mindfulness looks like, and also model for them that you struggle with it. I always tell kids all the time, this is tough to do to get your abdomen to raise, isn't it? I had some troubles with that, and you be able to relate to them that it's a skill to be learned and practiced. Okay, so take-home points. Mindfulness meditation helps children and adolescents better regulate their emotions. It really, really does, especially get the kids who are angry all the time or just almost explosive. Having them practice this, or walk away and do your deep breathing, relaxation, do a mindful walk, do sitting meditation where you're sitting down and paying attention to the sounds that you hear and the sensory input that you have coming in and so forth. Help them calm down and be able to regulate their emotions. This is almost like gold for that. Once they're able to master it, is they can really much better regulate their emotions this way. It's best if you're using this with other forms of therapy, so in conjunction with some other form of therapy or with another goal that you have. Mindfulness is great and it's used for a lot of things, but it's not a cure-all for everything. You need to be working on other things like coping skills with kids if they have anger, or maladaptive cognitions if they're having anxiety, or other things with depression and so forth. To be working on other goals as they do this. This is the skill to be used with a larger kind of grand unified theory. Mindfulness deep breathing is the core feature of all mindfulness, but mindfulness should not solely focus on deep breathing. You're going to get pretty bored kids really quick if all you're doing is breathing exercises. I know in our DBT adolescent group, they do breathing meditation, or they do mindfulness. They focus on it during one group, and they can't just do breathing mindfulness. You have to do other forms, otherwise you lose the kids. So that's quintessential here. It's great that you're doing pizza breaths. It's great that they're counting the breath, but you have to be doing more than just that, and that's when you get the sitting, the walking meditation, the seeing meditation, and playing with the games and so forth, helping them to be mindful and find instances to be mindful. Being able just to describe what's going on in their environment without judging it, is extremely helpful for kiddos. And as I said, practitioners should use these skills on themselves and become proficient before using it in session, because you guys really need to understand what mindfulness is and so forth, and be able to utilize it in your own lives and have examples of kiddos. It's a really good feature for all of us to have when we start getting upset.